Now, there has been a breakthrough when it comes to a certain cancer that many people are dealing with. I found out more. Did you know that bladder cancer is the 5th most common cancer in the United States? And until recently, those with the advanced form of the disease might have received the same type of treatment as they would have back in the 1980s. But today we have some amazing news. There is now the first treatment approved for people with a specific type of advanced bladder cancer in more than 30 years. To tell us more, welcome leading clinical researcher and oncologist Dr. Arjun Balar and Kevin Williamson, who is actually a father to 5 children, who was diagnosed with bladder cancer and who has received this new drug. Gentlemen, again, thank you so much for being with us.
Great. Thanks for having us.
Good morning.
Good morning. Now, doctor, I know I did just say that bladder cancer is, in that top 5, but let's kind of break that down even a little bit more. How many people really are affected by bladder cancer?
It's an excellent question. As you mentioned, it's the 5th most common cancer in the United States. An estimated 76,000 Americans are diagnosed every year, and about 10% of patients will be diagnosed in its most advanced form, or what we call stage 4 cancer.
And so we want to kind of get a little bit of education today. What are maybe some common signs, symptoms, things that people should be looking for?
When bladder cancer is first diagnosed, the first and most common presenting symptom will actually be just bleeding in the urine. It's occasionally associated with pain, but very often there will be no pain at all. However, ultimately, as the cancer progresses, one can develop pelvic pain or lower abdominal pain and other symptoms such as fatigue and weight loss and loss of appetite as well.
Well, it's good that we're kind of getting that information today and what we should be looking for. And now, Kevin, like I said earlier, you were diagnosed with bladder cancer. What was maybe your biggest concern once you received that diagnosis?
Well, being diagnosed with cancer is a very real event. And after the shock wore off that I had cancer, I wanted to know what my options for treatment were.
Well, speaking of treatment, how were you originally treated once you received the diagnosis?
Well, I had a cyst growing off of my bladder that had to be removed. So initially that was removed. It left some cancer on the bladder and some other places. So then I underwent chemotherapy, the standard chemotherapy for bladder cancer for about 3 months. Didn't have any results from that. So later that same year, I had a second surgery to remove my bladder and a few other organs. After I recovered from the second surgery, my doctor made me aware of trial drugs, and I actually got on a trial for another chemotherapy that's used for a different type of cancer that they were trying for bladder cancer. It worked pretty well for me for about 4 months, and then it stopped working and my cancer started to grow again. At that time, I was made aware of the Tecentriq trial that was becoming available. I got on that July of 2014. I've been on it for 2 years, and I've had really good results.
Well, and that's what we're talking about today. Doctor, how is it so important that we're talking about this new drug today?
Well, just as we, just mentioned, for the fact that for the last 30 years we're using the same exact treatments, to have a new treatment finally available for bladder cancer patients is really a major breakthrough. And Kevin's story, thankfully, is not uncommon. We have many patients who were brave enough to enroll in this clinical trial. And what we are seeing are stories similar to Kevin's, where cancer shrunk and patients are continuing on treatment a year, 2 years out, with the cancer not even growing. And we really never saw this before with any of the treatments that we had tried in the past. The FDA approval for this drug, makes this treatment now available to all the patients. Certainly there are side effects of this therapy, so that needs to be discussed with your physician to make sure this is right for you. But ultimately, to have this as an option is really a major breakthrough.
Well, and Doctor, where can we go to get some more information on this?
So the Bladder Cancer Advocacy Network is a very important organization that supports research in this disease as we continue our fight. Their website is www.beacon.org, spelled BCAN.org. And another important resource for information is the American Cancer Society. And their website is www.cancer.org.
Well, Doctor, thank you so much for that information. And Kevin, thank you for sharing your personal story with us as well.
Thank you.
Thank you.
Don't go anywhere. The Morning Blend will be right back.